Welcome to another video. I think this is the most overdue video I've ever done. It's been quite a few months since my last update. Fortunately, this is a pretty positive update. Everything's going kind of really quite well at the moment, which is wonderful. And it's largely thanks to your donations. So one thing that happened end of last year is I got a recurrence of my cancer in some lymph nodes, and I was quite distressed at the time, but my immunotherapist was very confident. He's been doing immunotherapy for over 20 years. He's treated hundreds and hundreds and hundreds of patients, and generally has quite a good sense of when things are going to be okay. But he did recommend doing some chemotherapy because the recurrence causes suppression of the immune system. And thanks to your donations, along with the chemotherapy, I was able to do immunotherapy as well. So I've actually been doing 4 treatments. So I've been doing some chemotherapy and immunotherapy in the kind of breaks between the chemotherapy, and weekly hypothermia therapy, which is using heat to cause damage to the cancer cells so that hopefully they're recognized by the immune system, but also to increase blood flow in the areas where the cancer recurrence is, so that more chemotherapy drug gets in there. And then I'm also taking a off-label drug, so that's where you get a drug that's designed for one purpose but seems to be beneficial for another purpose. So I'm taking a drug called metformin. The benefit of hypothermia therapy and metformin is probably very, very small, but they're both very cheap, safe treatments. So even if they just improve the immunotherapy and chemotherapy effects by 1 or 2%, then I think it's very worthwhile. So since the recurrence, I've had a couple of CT scans, and yeah, the results have just been fantastic. And I think that's, yeah, it's obviously due to the combination of treatments, but particularly the immunotherapy. Because I've been dealing with cancer for so long, the remaining, or in this case, the recurring cancer cells are probably quite chemo-resistant. But the results have been great, so I'm now on a lighter, easier chemotherapy protocol, and side effects are currently very manageable. It was quite tough restarting chemotherapy. One of the chemotherapy drugs, irinotecan, gives me really bad side effects. I'm not taking that chemotherapy drug anymore, thanks to the good results. So I'm very, very happy about that. And my immunotherapist is confident that I'll be doing okay and at some point back to full remission. So that's what I'm gently moving towards now. I could continue with the tougher chemotherapy and maybe get to full remission quicker, but the side effects are not fun, so it's much nicer taking a gentler route. I've been doing a lot of work with cancer patients around the world. I never give medical advice, although the cancer patients are always essentially asking for medical advice. but I have been helping people access treatment in Japan, and generally that's gone very well. Some more international patients coming next week, and I've been getting to meet quite a few of the patients, which is just wonderful. And also talking to carers around the world. Being a carer for cancer patients is incredibly tough, because cancer side effects, particularly treatment side effects, are quite unpredictable. Sometimes the patient may be fine on a chemo drug and suddenly start to get bad side effects. They might get bad side effects and suddenly do okay. And of course, there's a lot of stress involved with cancer. Stress waiting for treatment results, stress meeting doctors, particularly stress trying to find new treatments, stress involved in fundraising for new treatments. So carers have to deal with all of that, which is very, very tough. So, yeah, I've recently been talking to cancer carers quite a bit, maybe over the last sort of 12 months. And I've been running my website for cancer patients, where people can watch a video course I've made. And thanks to some incredible hard work from my friend Shantha, there's now good quality transcriptions for those videos as well. Essentially, I gave Shantha the automated kind of machine-generated transcriptions of the videos that were kind of quite garbled up, and she has somehow turned those transcriptions into understandable English, which is, that's really useful for so many reasons. So one thing is that because those transcriptions are on the website, makes it easier for cancer patients and carers to find the website with an online search, because there's now pages of text going with each video. It's also really helpful for people if English isn't their second language. They don't just have to kind of struggle through my videos. They can actually read the transcript. And of course, there are other people who just prefer to read, or who are hard of hearing, whatever. So that's a really wonderful thing. So directly I've been helping, I guess 100 or so patients maybe over the past 12 months, many of whom I've helped come to Japan, some of whom are coming soon, to get that immunotherapy that I had and am sometimes still having when funding allows. So that's, just incredibly rewarding. And it's a bit early to talk about people's results, but there's some people seem to be doing pretty well from it. With this kind of advanced treatment, I think the really important thing is to use these treatments together with a bunch of other treatments, and keep looking for ways that we can find and access newer treatments. One kind of very cheering bit of news is that there's been a big, well, by immunotherapy standards, a pretty big clinical trial of a treatment that I had. And this is where you use dendritic cells, but you prime them, kind of train them with tumor tissue. So this was a study for brain cancer patients. There's no reason to think the treatment would be particularly uniquely good for brain cancer. These treatments seem to be cancer agnostic, so they seem to give pretty good results for all hard tumours. The reason brain cancer was chosen for the trial is that there are very few effective treatments at the moment for brain cancer. So yeah, the results were really pretty good. Generally a doubling of overall life expectancy. It's called median overall survival, and that result is basically what my immunotherapist has had on average over the past 20 years. He's not able to do trials because he has such a variety of patients with different cancer types, so he's not in a position to be able to get 100 ovarian cancer patients on the kind of the same treatment and give them immunotherapy and get the results. It's more like case studies and general observations, which is not, it's not a good situation at all. It's not good data, but it was kind of cheering that this trial, which is a phase 3 clinical trial, so it's randomized with a control group. The results were really good, so that's fantastic. I've also been running my cancer Facebook group to help patients access treatment in Japan. That's generally been okay. It gets a bit tricky sometimes because some people in the group are very new to this rather unpleasant world of cancer, so they tend to misunderstand things. I've been dealing with this for I've been dealing with cancer now for coming up to 7 years, and I've spent many hours talking to patients and surgeons and radiotherapists and radiographers and of course oncologists and cancer nurses. So I've seen a lot. I'm nowhere close to having any kind of expertise, but I have some basic knowledge and quite a lot of experience. So sometimes it's a bit tricky when people are very excited about what looks like a good early result, or very disappointed with something that looks like a bad early result. And with immunotherapy treatment, the cancer does not behave and respond in the way that it normally does to treatment. And this has been recognized only in the last few years, really, by the world of oncology, and is fortunately now reflected in things like updated guidelines for doing clinical trials for immunotherapy, where the guidelines used to be that the trial was run like a chemotherapy drug trial, and that's completely inappropriate and has held back oncology quite a lot, sadly, and patients have died because of that, literally. But fortunately now people are understanding a bit more about some of the patterns you get with how cancer responds to chemotherapy. Not chemotherapy, sorry, immunotherapy. But it's still a very complex and complicated area of medicine. So that's challenging sometimes. But personally, things have been going very well for me. Kind of non-cancer related, non-clinical related stuff. A very dear friend of mine who is a surgeon is writing a couple of bits on my case for some clinical publications in Japan. So that's really useful because she's writing the articles about me from focusing on a patient choosing their own treatment path and talking to lots of different specialists and making their own treatment decisions and getting what is an exceptional result. So I think it's very useful for oncologists and other doctors in Japan and around the world to kind of see how these things can work out in some cases. Yeah, so that's wonderful. Another completely non-cancer related thing, but still very positive, is I'm getting a bit more involved in hospitals, clinics, universities, and medical universities here. And that looks like it's set to increase a lot over the next few months and throughout the rest of this year. So just like a small thing I've been doing is I've been involved in training medical students to do medical consultations in English. So these are Japanese medical students who will be working in Japan and may have international patients, and also Japanese medical students who are going to go on exchange programs where they'll be in English-speaking countries, specifically America. So that's just a really great thing to be involved in, and I'm starting to build more of those connections with teaching hospitals and medical universities and clinics and things. So that allows me to, for example, get speaking opportunities where I can go and give a talk to newly qualified doctors, for example, about my experiences with cancer. So that's a very positive thing. So yeah, generally I'm pretty healthy and happy at the moment. I need to get fit and strong again. It's quite surprising how just a few months of chemotherapy can sap your strength a lot. The chemo I've been on called TS1, it at least for me at the moment, it makes me very hungry, and it also causes quite a lot of fatigue, so you have to really push yourself to be active. But yeah, I'm getting more active again. Also seems to make me more sensitive to the cold, but fortunately Tokyo is warming up very nicely now. So yeah, my chemotherapy protocol is now gentler and the weather's better, so basically things are really in my favour at the moment, and therefore I have no excuse for not getting fighting fit. So that's a big thing to be working on at the moment. Get back into running, and just looking at my other things, again unrelated to anything but very cheering, is somehow my Japanese is improving a bit. This is not through kind of serious study, but I've just found myself in more and more situations with people who don't really speak much English at all, and just the practice has been helping a lot. And again, this is kind of actually useful because it means it's going to be easier for me to get more connected with the health system here, so I can really start getting doctors and researchers and patients together, sharing information, training together, and really improve the outcomes for cancer patients. Right, get people living longer, having a better quality of life, hopefully getting more people to be cured. yeah, so that's all kind of good. And just one more thing to mention is, like I said at the beginning, I've been able to have immunotherapy because of your donations, which I'm incredibly grateful for. So, yeah, please do keep sharing my fundraising link if you can. It's incredible to see the donations still coming in. And a friend of mine, Angie Sinclair, is also raising money for my immunotherapy as well. And that's fantastic. And she's doing a really, really impressive job with that. So yeah, that's it for this update. But as usual, yeah, thank you for your patience. And more updates will hopefully come in a more timely manner from now on. Yeah, things are going well at the moment, and life is getting considerably easier than it was just a couple of months ago when I was really struggling with the heavy chemo protocol. Yeah, so the protocol is a 3-week cycle. It's drips at the hospital on day 1, and then 14 days of chemotherapy tablets, and then 6 days off. And when I started the protocol at the hospital, I was having 2 drugs, bevacizumab, also called Avastin, and irinotecan. I always forget the other name for that. And the irinotecan is like not well tolerated by my body. So I would typically be incapacitated for the first week and then pretty weak in the second week, and then starting to feel okay a few days after the tablets had finished, and then have 2 or 3 days when I felt quite good, and then it would be time to go back to hospital for the next drip. I'm still on the 3-week cycle, but the drip at the hospital now is just 1 drug, bevacizumab, which I tolerate well. In fact, many patients tolerate it quite well. And then my 14 days of chemo tablets, but without any kind of being incapacitated. So that's good. There are side effects, but they're mild at the moment. So anyway, thank you so much for your continued interest and support, and I shall talk to you again soon. Take care.